Hi, my name is Bruce Doran. I'm one of the staff scientists that works at Science North, and February is Heart Month, and I want to use the opportunity to show you how to use an AED, an automated external defibrillator, which we use when somebody is having a cardiac arrest. So we're going to do our scenario here. So we're going to assume this person is unconscious. I'm unable to wake them up. I can't feel any breath. So I'm assuming this person is undergoing cardiac arrest. So first things first, I'm going to call for help. All right. So we're going to assume that I called for help. All right. And now I'm going to use the AED. So AEDs are usually within a case. So I remove it from the case. And the first thing I'm going to do for this specific model, I'm just going to press the green button to activate it. And I'm going to follow the instructions that the AED will give me.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
So normally there's a pair of scissors in the case, and you want the pads to come into contact with the skin.
When patient's chest is bare, remove protective cover and take out white adhesive pads.
So this one, you just pull off the protective cover, and then there's white adhesive pads.
Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner.
So I just follow the instructions and put it in
Place pad
the...
exactly as shown in the picture. Press firmly to patient's bare skin.
So I'm going to press the pad as indicated by the picture. The first one will go here.
When the first pad is in place, look carefully at the picture on the second pad. Peel the second pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin. No one should touch the patient.
So it's analyzing to see whether or not it's got a shockable rhythm.
No one should touch the patient. Shock advised. Stay clear of patient. Press the flashing orange button now. Shock delivered. Be sure emergency medical services have been called.
Well, that's
It
good.
is safe to touch the patient.
A good reminder.
Begin CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat.
Using my body weight to push down. I'm not pushing with my arms. The pivot point is with my hips. And I'm just following the rhythm of the metronome.
Pinch nose, tilt head, and give 2 full breaths.
I'm not going to do that.
Breathe. Continue with compressions.
If you feel comfortable doing the breaths, go ahead. If not, you can just continue with chest compressions.
Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions.
So the AED is like a coach. It tells me exactly what to do.
Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions. No one should touch the patient. Analyzing.
So again, it's analyzing whether or not it is a shockable rhythm.
Shock advised. Stay clear of patient. Press the flashing orange button now.
So I would continue with what the AED is telling me, and essentially it is a coach, okay? So with an AED machine, what essentially does, it sends a shock to the heart to restart it if it is a shockable rhythm. And then hopefully with also your chest compressions, you're increasing the chances of that person from surviving the cardiac arrest. So hopefully this gives you kind of an example of how to use an AED machine. You don't have to be afraid of it. It cannot hurt you. I can put the tags on my head. It won't give me a shock. It will only give a shock under certain circumstances. So if that person actually has a heartbeat, it will not give them a shock. So use it to be able to save someone's life. And hopefully, with this, with hands-only chest compression, you'll be able to save that person's life.